Good morning, good afternoon, and good evening, wherever you are. Okay, so my name is Dr. Teofilo San Luis Jr. I'm from the Philippines, and tonight is our exciting topic on with two good ladies who are both from the United States, and I'd like to introduce them to you. The first one is Amy Graeber. She is from New Jersey, and she is a registered diagnostic medical sonographer, ultrasound technologist for that matter. And the other one is Blythe Clifford. She's an attorney from Raleigh, North Carolina, also from the United States. And so we have here the topic on the thyroid. And as you very well know, the thyroid is a very important organ that is sometimes overlooked in its manifestations. And even if there are very, very obvious manifestations, sometimes they are ascribable to other organ systems. And so here, our two ladies here will be able to provide us with a glimpse of what their journey through life had been as impacted by the thyroid gland. So let me ask Amy, can you give a preliminary information on what you have? Amy?
So I was originally diagnosed with Hashimoto's disease, and shortly after they diagnosed me with thyroid cancer. So I now do not have a thyroid and live just on thyroid hormone replacement.
Okay, yeah, that's quite a shortened version of a long history. We'll dwell into that.
Time, so I figure I'll let you kind of.
Yeah, we will dwell into that. What about Blythe? Can you give a brief statement of what had happened to you ever since?
Sure. I was diagnosed with hypothyroidism during my struggles with infertility. And once treated for hypothyroidism, was able to conceive. Was later diagnosed with Hashimoto's and Sjogren's, which, as you all know, are both autoimmune disorders. And I happen to be a member of what I would call thyroid family. My husband was diagnosed with Graves' disease and has since had a total thyroidectomy. And both of my children were born with congenital hypothyroidism. So we have enough thyroid medication to start our own pharmacy at our house.
Okay, so those terms that have been brought up by our two lady guests, Hashimoto's thyroiditis, thyroid cancer, Graves' disease, all of those things have to be made known to our viewers and to our listeners in terms that probably they will understand better. So, Amy, when you were at what age were you diagnosed to be having this problem of the thyroid, and how was it diagnosed, and how was it manifested from the very beginning?
So I wasn't diagnosed until I was 28, but I had been experiencing symptoms. I can really trace it back to early childhood, but really from the time I was about 16. It was a 12-year journey of going to doctors, multiple doctors, specialists, every test you can imagine, trying to find out what was going on. And nobody could figure it out. I was just kind of like this medical mystery. I pursued it for about 2 years when I was a teenager, from 16 to 18. I was told at that point that I had borderline hypothyroidism, but it wasn't anything I needed to be medicated for, and really probably wasn't causing any of my symptoms. So I just lived with it for a long time. I believed the doctors rather than listening to myself. And I suffered for a very long time. And then I ended up having my son when I was 26. He was born prematurely, which we now believe was likely caused by my thyroid issues that were untreated. And I just deteriorated very badly after that for the next couple of years. things went really crazy, and I went back to pursuing doctors, and finally was diagnosed with Hashimoto's at 28, and 3 months later was diagnosed with thyroid cancer.
Well, that seems to be, one after the other, one blow after the other.
Yeah.
And how did you manage to, get through this diagnosis, which seemed to be, providing you with, the important thing is that the diagnosis has been given, and you have had consultations from endocrinologists. Is that right?
Yeah. So I was sent to an endocrinologist. We did the ultrasound, did some biopsies. I ended up going to a couple of different endocrinologists over those years, before and after my surgery. And it was a struggle. Not every doctor was willing to really listen to me and my symptoms before and after. They would basically just look at the numbers on the page of my lab results and say, well, it's not your thyroid. Well, we know it's not your thyroid because that's normal. And in the end, it was my thyroid, and those numbers were wrong, and they've always been wrong. But it just ends up being this issue where doctors a lot of times don't listen to their patients and look at the whole picture. They're very blind by numbers, and a lot of us as patients feel as though we're treated as a number on a piece of paper rather than as a person who is experiencing real symptoms and real struggles in their day-to-day life.
Well, it looks like that you have had quite a number of manifestations that could be interpreted in whatever way. Your doctors probably, your endocrinologists, I'm sure, were making things through the numbers that they were seeing, and also through the symptoms. Many of the things that the thyroid manifests either by hyperthyroidism or hypothyroidism, they are in opposite directions, and sometimes this can be very difficult to be put into the proper context.
If I might, Amy, there are 3 things that you mentioned that I think seem to be common threads in almost all of our stories. The first is that you were disregarded by your physicians. And I think that that is a common theme that we often hear, is that physicians are often not listening to their patients, particularly to women. And we really need to continue to advocate for ourselves. It is not normal to be tired. It's not normal to have hair loss. It's not normal to have all of these things that are typically attributed to women. Oh, it's just, you're just tired because you're a mom, or now it's menopause. Oh, it's premenopause. There's always some thread. And, thyroid disorders, as you know, Amy, and I know, are not one size fits all. It is a balance of treating both the numbers and the symptoms. The other thing that you mentioned that I think is similar to my story and probably others is that you believe that your thyroid disorders began when your disorder began when you were likely a teenager. I had a similar experience as far as, beginning to struggle with depression in college, anxiety in law school, again, attributed to everyone is stressed out. That's, we're all stressed out. We're in grad school, right? That's not anything. And I think that it is important that we begin talking to young men and women when they are in their teens about the potential symptoms of thyroid disorders, because until I was tested by a reproductive endocrinologist, I had no idea. I didn't know anything about thyroid disorders. I had no idea, that they could impact my fertility or anything else. And then the third thing that I think is another common thread, particularly with thyroid disorders and pregnancy, is that it sounds like you were either not pre-screened before you conceived, or those numbers were disregarded. I know for myself, I struggled with infertility for over a year before anyone thought to check my thyroid levels. And, you know, as you and I both know, untreated thyroid conditions can lead to a series of complications for both mom and baby, including premature birth, which is what you experienced. And many women can suffer miscarriage, or their children are born with thyroid issues as well. And this is all preventable.
Yeah.
We just could check thyroid levels and treat them.
Were any of you told by your doctors that oh, you are just you have just read too many of these things in the internet? Were you told about that? That your information might have been due to misinformation coming from the social media? Were you ever told about it by your doctors that?
I was, after my son was born, when I was deteriorating and going to all these doctors to find out what was going on, yes, that was definitely a struggle. It was, I lost my train of thought.
That you were influenced by social media?
Yeah. So I did a lot of research on my own, because not so much with social media, but I did a lot of research on my own, just trying to find out what was going on with me. I felt desperate to find out. I knew something was wrong. And when I went into these doctors with research I had done from the internet, they almost kind of like roll their eyes at you. And it's like, oh, okay, yeah. So, you know everything because you went and searched on the internet. And it's, no, I know my body. I know what I'm experiencing. And I know that this isn't all in my head. I know that this isn't just depression. I know that this isn't just being tired. There's more to it. And I need to be heard. And I was right. And that's the most frustrating part, is that I went in, the first doctor I asked to test me for Hashimoto's flat out told me no. She was doing lab work anyway. And she said, no, I don't think we need to test for that. Said, like, I know that I think that this is important. I need to know if I have this. I think I have this. She wouldn't do it. So I went to my doctor feeling like a crazy person with a stack about this big and said, look, I know you're going to think I'm nuts, but I know that this is what I have and I just need to be tested. And I was right.
Well, it sounds like that, in a situation where the clinical manifestations seem to be conflicting with the evidences, do you think doctors believe more the biochemical and the laboratory testing rather than their listening to patient symptoms?
1,000%.
Would that be an indictment on the healthcare system that you have?
What's that?
Do you think that would be an indictment that doctors are listening more on the biochemical and the radiological images rather than the clinical manifestations of patients?
Yeah, I think it's poor patient care. I think that it's not helping anyone. It's not helping them to learn and guide their patients and be a good doctor. And it's not helping their patients to have any semblance of a quality of life.
Yeah, it's true. I mean, that is, as a physician, I feel hurt also when those things are hurled to us, that you are all preoccupied with the numbers and not on patient symptoms. We think that sometimes these are all, coming in the mind of the patient only. Is that your experience, Blythe Clifford?
Yeah, so I have had a little bit different of an experience in the sense that, my path was a little bit different. The failure for me occurred between me and my OB at the time, my obstetrician gynecologist at the time. And it wasn't one person, right? I went to a large practice with multiple doctors. But, as I kept coming back, I'm still not pregnant. I still can't get pregnant, that was my singular focus at that time. And it was never mentioned that perhaps we should check any lab levels. It's normal, is what I was told, to take over a year to conceive. At that point, I was still in my 20s. And I was very willing to take the word of the physicians that were treating me that, okay, so this is normal. After, a year had passed, and then eventually I think they were sort of like, we don't know, maybe you should just go see a reproductive endocrinologist. So I did that, and I walked in the door, and one of the first things they asked me, is, have they checked this? Have they checked that? And they just kind of list this long thing. And I'm like, no, they only checked to see if I was anemic, which as a vegetarian, I often am anemic. So, okay. And that was when the reproductive endocrinologist at that point had diagnosed me as being hypothyroid and put me on medication. I didn't do any research. I'll be totally honest. I was young and naive, and I just wanted to have a baby. And I think if you had handed me, a bowl of chocolate and said, this will get you pregnant, I probably would have just taken the bowl of chocolate, right? At that point, I was so trusting of the physicians that were caring for me. I'm very thankful that the reproductive endocrinologist did all of that testing. Once treated, I was able to conceive, and I was referred back to my obstetrician to continue to care for me during pregnancy. At some point during my pregnancy, it was discovered that my thyroid levels had not been appropriately managed throughout my pregnancy. I trusted, again, hearing the words, your levels are normal. I will never trust those 3 words again in my entire life. Again, this was almost 16 years ago now. So that the software that exists now where you can go in, log in and check your own thyroid levels, that didn't exist at that point. So you waited for a phone call, right, from a nurse to tell you, oh, that is normal. But as it turns out, for the majority of my second trimester, my thyroid levels were actually not in the normal range.
Not in the normal range.
They were not. Yeah, I was told that they were, but they had, so I was actually hypothyroid for the bulk of my second trimester. And I was pretty upset about that when I learned that. And then, at that point was when the light sort of went off for me, as kind of what happened with Amy, but she was a little savvier than me a little sooner. At that point, I thought, I no longer can trust anyone to manage this for me. I have to do the research and begin to manage and take control of my healthcare. And then, of course, when my first child was born with congenital hypothyroidism, which for those of you who don't know what that means, congenital just means you're born with it. So he was born in the United States. We have state mandated newborn testing for congenital hypothyroidism. That's been around for over 50 years. So I have a lot of people tell me, well, my child wasn't tested for that. Yes, they were. Unless you opted out of the newborn screening that's done within a few days of every infant that is born in the United States in a medical facility. So of course, at that point, that was when I started worrying about, what other impacts my thyroid levels being mismanaged during pregnancy had on my son. And that was really the impetus for me to begin. And that was, like Amy said, she started with like all the labs and all the research. And that's when we as a family really started to learn, educate ourselves, and start managing our own, path with this. And but I have to say, in the opposite of Amy, my husband and I both have had fantastic endocrinologists. We are so glad we landed where we did with them. And then my children also have a wonderful pediatric endocrinologist that has been their physician since birth. So we have not had the same experience that Amy has had as far as being disregarded. For me, that really happened, unfortunately, with my obstetrician. But once I landed with a fantastic endocrinologist, I had an advocate and somebody who was listening to me. So my experience has been a little different than Amy's.
Yeah, I mean, I'm sure when your child was born and diagnosed to be having congenital hypothyroidism, that must have been a very impactful thing for you. And this was, of course, made possible through the newborn screening program. And were you told immediately about the result of the newborn screening? That your child was hypothyroid?
It was, we have a pretty good, reporting system in North Carolina where I live. I was told fairly soon after we arrived home from the hospital. We received a call from our pediatrician, and then actually a call from the state health department saying, these are the lab results that we have received. Do you have an appointment? And so we were, again, we have a wonderful pediatrician as well, and he immediately referred us to a children's hospital and a pediatric endocrinologist. So within, I would say, and so they also, as many people don't know, they do a set of follow-up testing, right, to make sure that the thyroid levels aren't high just because of a surge from mom. And so they do some follow-up testing, and children who do not have congenital hypothyroidism, eventually those levels will drop down and become normal. With both of my sons, the repeat testing just showed more elevated TSH levels as we went along. And so they were put on medication probably around 3 weeks. 3
weeks after birth?
Yes.
And they were both given levothyroxine?
Yes, they were. Our pediatric endocrinologist felt like at the time, because in where we live with generic medications, there can be about a 5% difference in generic medication, either up or down. And so our pediatric endocrinologist wanted both of them on brand name, which is Synthroid for us. And so they remained on, they actually are both still on Synthroid at this time. They have taken generic versus brand name and done well on both.
If we just retrace back a little bit on your pregnancy, at what stage of the trimester that you were having, were you given any treatment for your hypothyroidism? For the
Yes. So I remained on levothyroxine throughout my pregnancy. Of course, I started before I became pregnant and stayed on. But for many women, I'd probably even say, Amy, you may agree with me on this, most women will need more thyroid medication throughout their pregnancy because of the changes in hormone levels. Now that's for people with hypothyroidism. Folks who have, hyperthyroidism, sometimes they actually might do better during pregnancy. So with some of their levels, but, it's really, again, it is not a one size fits all, and it really requires constant monitoring throughout pregnancy. And one of the more dangerous things, of course, we talked about this, right? Untreated hypo or hyper. So hypo is underactive thyroid, right? Hyper is overactive. And sometimes that is linked to autoimmune, right? Graves would be the autoimmune hyper, and Hashimoto's, as Amy alluded, is typically hypo, but Hashimoto's can do weird things and make you both hypo and hyper, which is why it's so complicated. Those can have detrimental effects on mother and child during pregnancy. But also, I think you can see just by all of these different, Amy and I are just two examples of this. This is something that, is very common among women, but also as you mentioned, Dr. San Luis, some of these symptoms so closely mimic other things. It could also be something that mimics a vitamin D deficiency, or an iron deficiency, or other things. And so a lot of the symptoms too, if you're not pre-screened before becoming pregnant, if you walk into the doctor's office and say, "Whew, I am exhausted. I am not sleeping well," right? Well, that sounds a lot like pregnancy, right? So, you know, a lot of the symptoms are very difficult to distinguish. You can, you know, extreme tiredness, constipation, problems with memory. Those are all things that are also common symptoms of a normal, healthy pregnancy.
Exactly. Yeah. Now,
so it's easy to understand how it can be missed, but you know, again, why? Because of the risk of serious complications, why are we not screening all women? Especially because the issues can be so detrimental, particularly in that first trimester. Yeah, so if a woman is walking into your office saying, "All right, I'm ready to start trying to have a baby," why are we not screening them for thyroid disorders? Or, you know, or guess what? I'm pregnant. What do I need to do? Well, the first, right? Why don't we check your thyroid levels? Like that's what I want to hear. Amy, what do you think?
It's true. It's true that, you know, the importance of having a screen will be there, and but some of the guidelines of the American College of Obstetrics and Gynecology, sometimes they do not get a universal screening of women. You know. No, but let me go back to the child who was born to your first. Were you told by your pediatric endocrinologist that there could be an impact on the intellectual development of the child?
We were, if he was untreated, but treated and well managed, we were told that he should grow up to be, you know, a normal, healthy.
So you were reassured about that? Because
we definitely were, but as a new mom, I'm not sure that I entirely believe that. Mm-hmm. You know, I had tried so long to have a baby, to finally have a baby and him to be born with a thyroid disorder, knowing that my thyroid disorder had not been appropriately managed. I carried a lot of guilt. For a long time, I thought that it was something that I had caused.
Well, in the second pregnancy that you had, did you have, you know, would it be the same episode that you had with the second pregnancy?
For me, by then, I was monitored by an endocrinologist as well as my OB. So, and I was like on top of it, right? I knew how to advocate for myself. So I would say that was you know, a little bit more
experience already by that time.
Of course, yeah.
Good. That would be an important thing, because at least you learned from the experience from your first child. And the second child was also born and detected through the same mechanism?
Yes, he was. And we were already, you know, obviously on alert for that, as well as our pediatrician and pediatric endocrinologist. We knew that there was a possibility that he would also be born and diagnosed with a thyroid disorder, particularly since in that, you know, in the meantime, we had also discovered that my husband had Graves' disease. So we were feeling fairly confident at that point that there was a genetic component to what was happening in our family. And so, you know, in many ways, of course, I was disappointed. I was hopeful that my second child would not be burdened with, you know, a lifelong thyroid disorder. But at the same time, now that they're both older, they are 11 and 15 now, both healthy, normal.
Doing well in school?
They are both doing well in school. Good. And all of that. They're growing and developing normally, which is wonderful. In a way, I don't know if glad is the right word, but I do think in a way that there's just a bond that the two of them have because they have experienced this same thing. And I think it's in this sort of weird way, like we all get up in the morning and we all take our thyroid medication. So as weird as it is, and sometimes a little complicated with all four of us, you know, being on medication and having blood draws and appointments, you know,
the daily regimen. Okay.
Yeah, yeah. In a weird way, I guess it's good that we all go through it together.
Right. Now, Amy, with your background being as a registered diagnostic medical sonographer, I'm sure you are aware of the situation in your hospital and the fact that you had thyroid nodules. Did you do, I mean, your in the diagnostic ultrasound that was made, did it show that it could be a malignancy of the thyroid that you were having?
So I actually, just to clarify, I did not become an ultrasound technologist until after my thyroid. So my thyroid journey basically led me on that path in what is.
I see. Okay.
I became very fascinated. I had to get ultrasounds done myself very regularly. But mainly I would say it was like the biopsy process for me. And I just was really fascinated and felt like the technologist that was there helping and holding my hand and just so caring. And I was like, you know, I would love to be able to do that. But they did end up seeing on my ultrasound when after my Hashimoto's diagnosis, they found tumors in my right thyroid lobe as well as some abnormal looking lymph nodes. So they were pretty sure ahead of time that this was going to be malignant. But of course, they wanted to do the biopsy. My first biopsy came back indeterminate. We didn't really get enough of a good sample. So I had to go back and get another one. They tried to go into the lymph node that time, but it was kind of tough, like under my collarbone. It was a little tough to get to. And so they ended up going back into my thyroid and did prove the diagnosis.
Sampling. Yeah, more sampling. And then it eventually led to a total thyroidectomy, did you say? Yeah, total. And then thereafter, you had your radioactive iodine ablation.
Correct.
Okay.
Correct.
And ever since you are already now on your desiccated thyroid?
Yeah, not at first after my surgery. I was on Synthroid and Cytomel.
Synthroid also, okay.
Yeah, originally, but I was still very symptomatic. I was not at all doing well. The doctor I had at that point was not really listening and willing to help me. So I sought another doctor yet again and found someone who was willing to listen. I'm actually still with that endocrinologist today.
And right now, you would say that your workup and your monitoring is optimal, you would say?
Correct. Yes. My TSH is kept at an undetectable level. That's to prevent future cancer growth because it is thyroid stimulating hormone. We don't want to stimulate any thyroid cells that could be left in.
Exactly.
But we do check thyroglobulin as a tumor marker and annual ultrasounds as well.
Yeah, that's right. You know, and now you would say that you are optimally being followed with your.
At this point, then mainly because I speak up for myself so often.
Now,
because I struggle with my labs do not reflect my symptoms. So that is my entire life where my labs don't reflect my symptoms. And to Blythe's point earlier about the pregnancy screenings, I had a screening during pregnancy. My TSH was checked during pregnancy and was within normal limits. It was actually, looking back over my records later on, it was the highest my TSH has ever been was when I was pregnant.
Really?
But it was still within the normal limits. At that time, I had no diagnosis. I was not on any thyroid hormone medication at all. And my son was born 7 weeks premature, which studies have now shown that there is a link between Hashimoto's low thyroid levels and premature birth and premature rupture of membranes, which is what happened with me. So looking back now, I know that had I been diagnosed earlier at 16, 17, 18, when I was pursuing all of my symptoms and told it was normal, he might not have been born premature. Oh,
but how is he doing now?
You would never know it now. He is fine. He's 12 years old and he's wonderful. You would never know he was a preemie.
Yeah, that's good. I mean, and is he on any medication as well?
No, he actually has not had any issues with that. He does have ADHD, but we did at one point, I want to say it was at least 5 years ago, he was having some symptoms that I was like, maybe we should get it checked, considering my history and everything. We did run full thyroid panel, TSH, free T3, free T4, and I had them test him for antibodies as well, and he came back negative. So it's just something kind of keep in the back of our mind, considering my history and the fact that I was untreated and possibly even had thyroid cancer while I was pregnant.
Now, going back to your thyroid cancer, you very well know that, of course, papillary cancer is very common. But the follicular variant is something that you have to be aware of.
Yes.
Did you have any of these tumor markers about this, the antigens and the antibodies that are usually taken care of, and also about the many things, the panels of antigens and antibodies that are being done on these malignancies. There are quite a number of these malignancies, the follicular cancer, the anaplastic, and all of those things. And this is, of course, related to the level of iodine deficiency. You know, in this part of the world, in Asia where I'm living, there's quite a number of papillary tumors, and this becomes more malignant in the presence of iodine deficiency. But of course, in the United States, I suppose you have a supply of iodized salt, and you get your iodine quite well, and so it's not probably much of a problem of iodine deficiency. But in many parts of the world, iodine deficiency has an impact on the aggressiveness of thyroid malignancies. Yeah. Anyway, so
Heard that. Yeah, that's interesting.
That's interesting. Yeah.
Part I was told that we had to be very careful with mine, partially because of the follicular variant, and partially just the extent of my disease. I had a lot of local spread. I had the one lymph node that was greater than 4 centimeters, had extension outside of the node. The pathology report put the word lymph node in quotes, which the surgeon was very confused by and was like, I don't really understand why they said that, and called the lab and spoke to them. And they said that essentially they believed it was a lymph node originally, but it was so overtaken by the cancer that it was essentially all thyroid tissue. It was essentially all thyroid cancer, and didn't really have the typical characteristics of a lymph node anymore. I had other smaller tumors that were growing on my vocal cord nerves. It was a mess in there.
Well, you look quite fine right now. I mean, you don't seem to have any trace whatsoever.
Later,
wow, even the scar is hardly seen.
Yeah, it's very.
Your surgeon must have been a very good surgeon.
It was excellent.
Now, Blythe, in the fact that you are now, your family is all taking thyroid medication, and what seems to be the overriding consideration in your family now? That you have this, your husband has Graves' disease, treated with radioactive iodine. You were Hashimoto's, and your sons had congenital hypothyroidism, but they are luckily they're doing quite well. What what do you think of the outlook of your family in the next few years?
Well, I think, we've been doing this for a while now, and we know what we're doing. We know how to manage this now. We have great physicians that help us with this process. My husband and I, and my older son, now that he's over 15, our thyroid levels are checked about every 6 months. My younger son, his thyroid levels are checked about every 4 months, or if there is some change. And so, we know the symptoms to look for if they have become either hypo or hyperthyroid. We know what to look for, and we have an excellent open dialogue with our physicians about, whether we need dose changes or things like that.
And do you provide also counseling to moms? I was told that you
I
are a
do.
thyroid mom.
Yeah, it's a volunteer job to get paid for this, but I am, always willing to talk to any parents of children with thyroid disorders and share our experience and offer, the advice that, non-medical advice that I've learned.
Okay, so when all has been said and done, what would you say that the lessons that you have learned from this having a thyroid problem, and as a summary statement?
Amy, do you want to take that on?
Okay.
I mean, I would just say, you need to advocate for yourself. You know yourself better than any doctor does. Doctors are professionals. They learn a great deal of information, but you still know your own body, and you know what is normal for you and what is not. And I think the biggest thing for me and what I tell other people is, don't take no for an answer. If you know something is wrong and someone's not helping you, find someone else that's willing to help. Don't suffer. Don't go through what I went through and just think, I'm just crazy. Like, this is just, I guess everybody just feels this way, and suffered for years and wound up in a lot of bad situations because of it, when really all that needed to happen was one simple test. Could have been done all those years ago. If they had just checked for antibodies, they would have seen it. If they had just done an ultrasound, they would have seen it. And it could have changed the course of my entire life. Now, for me, it worked out in a lot of ways. I do love what I do as a career now. I don't think that I would have gone there and done that had I not been through these experiences. And I do love helping other patients. I speak to other patients all the time. I get messages from people a lot, and I love to be able to help guide them to help themselves.
Very good, Amy. What about you, Blythe?
I agree wholeheartedly with everything Amy just said. That is typically the same advice that I give. And as far as, parents whose children have thyroid disorders, I always say, you are your child's best advocate. You are the person who knows your child best. And you will always be their very best advocate, and never hesitate to ask, to push for answers. And so, whether, like Amy said, whether you're dealing with yourself or your children, you have to continue to advocate for yourself.
Okay, so well, at least for our listeners and the viewers, we have gone through the interview of two women who have similar but contrasting manifestations, and you have heard them speak about the saga of their journey of having a thyroid problem that might appear to be innocuous from the very beginning, but may have very great impact on particularly when they went through the reproductive period, and complicated by the fact that their children were also affected by the disease. So the thyroid is something that sometimes is operating under the radar screen. It's not very, it does not create a lot of, you may say, drama, just like cancer, like cancer of the breast, for instance, and also hypertension. because these are things that can be that may have to be ventilated in public. That thyroid may be very innocuous from the very beginning, but its impact in later life can be very devastating. And it's a tribute to these two women that they have survived the challenges that they have gone through. And well, the healthcare system has provided for them. The influence of social media is definitely to be reckoned with. We learn from many things, and doctors, particularly like myself, we also learn from patients by interacting with them and listening to them. I think that is one lesson that doctors will have to learn from you, ladies, that we have to listen attentively to whatever you are saying. So, well, in this past 46 minutes of our interaction, we have gone through the various diseases that have been mentioned by them. It's not easy to compress the diseases into into a 3/4 of an hour discussion. Each one has its own we may say a plethora of diseases, a plethora of manifestations, and many things that could be discussed more in detail. The diagnostic aids are there, but you know, it's good that our healthcare system allows us to have all of these tests and imaging devices for the thyroid. So I'd like to thank the Foresight Global Health for the opportunity of having presented the various aspects of the thyroid. You know that we have just celebrated the International Thyroid Awareness Week last week, May 25 until May 30, 31. And this is a very good sequel to that International Thyroid Awareness Week. Maybe we can have a spin-off in this and a cascade of all of this information through various other media. And it can be either the print, tri-media, or social media. And we would like to express our appreciation to the Foresight for the opportunity of bringing to them thyroid as a very important disease entity. Thank you very much, Safia Carrillo, and particularly Blythe Clifford and Amy Graeber, and give my regards to your family.
Thank you so much, Doctor.